Hey everyone, and welcome. If you're a nursing student, you've come to the right place. Today, we are going to master a skill you will use pretty much every single day on the floor: IV maintenance. Now, it might seem simple, but trust me, getting this right is one of the biggest things you can do for patient safety. We're going to break it all down so you can nail it every time. So if you're ready to build that kind of confidence, go ahead and hit subscribe for more nursing explainers just like this one. So, are you ready to do this? Let's build up that confidence so you can handle this procedure like an absolute pro. We're going to use a super simple framework that will have you walking onto the floor feeling totally prepared and in control.
First up, part 1, prep. This is all about the why and the what. And this is so important because great nursing care, it doesn't start with doing things. It actually starts with thinking and understanding. This prep work is the absolute foundation for keeping your patients safe.
Okay, so let's get right to it. Why do we even do this? It's not just busy work to swap out a bag. It's about two massive things: preventing dangerous bloodstream infections and making sure our patient gets the right therapy without any interruptions. Every single step we take from here on out connects back to these two critical goals.
Now, let's talk about this number. 96 hours. You need to burn this into your brain. The CDC recommends changing the tubing for continuous infusions at least this often. And why? Well, it's to stop something called biofilm from building up. Think of it as this gross, slimy layer of bacteria that can form inside the tubing, and it can become a direct pipeline for infection. So this isn't some random hospital rule. It's a critical, evidence-based time frame. And yep, you're definitely going to want to remember that for your exams.
So before you even think about gathering your supplies, your very first stop is the patient's chart. You've got to be a detective. Are you hanging the exact fluid the provider ordered? Does the patient have any allergies, like to latex or maybe even the medication itself? Could their medical history, say kidney disease, affect how they handle these fluids? Checking all these details is what stops major errors before they can even happen.
I want you to think of these as your 3 non-negotiables. You do them every single time before you even touch the patient. First, you confirm those allergies again, out loud with them. Second, you use 2 patient identifiers, usually name and date of birth, to make 100% sure you have the right person. And third, standard precautions, which at the very least means your gloves are on. Okay, you've done the mental prep, now it's time to gather your tools. Having everything you see here right at the bedside before you start is a total game changer. It makes the whole process smoother, way safer, and just more professional. You really don't want to be that person running out of the room mid-procedure because you forgot a simple label. All right, prep work is done. Let's shift gears and move to part 2. This is the perform section, the how-to. We're going to walk through the actual procedure step by step, so there are absolutely no surprises when you're doing it for real.
So your interaction with the patient starts right here. Pull that curtain for privacy, introduce yourself, and perform hand hygiene right in front of them. Then tell them what you're about to do. A simple sentence like, "Hi, I'm just going to change your IV fluid bag and the tubing to keep everything clean and safe for you," can make a world of difference. It reduces their anxiety and builds that crucial trust.
Now, before you change a single thing, you assess. First, look at the patient as a whole. Do you see any signs of fluid imbalance? Then zoom in on the IV side itself. Look for any redness or swelling. Gently touch the area. Does it feel cool or hot? Ask if there's any pain. Once you've confirmed the site looks good, it's time to prime the new tubing. This means you flush out every last bit of air. Skipping this is a huge no-no because it could cause a dangerous air embolism.
Okay, this is the moment. This is where your technique is everything. First, stop the old infusion. Clamp it. Disconnect the old tubing. Now, for the most important part, scrub the hub. You clean that port with an alcohol swab for at least 15 seconds. And, this is key, you have to let it air dry completely. Then, without letting the sterile end of your new tubing touch anything, you connect it. That sterile technique, it's your #1 weapon against infection. And here is a pro tip you should never, ever skip. Label everything. Seriously, the new bag and the new tubing both get the date, the time, the infusion rate, and your initials. This is so critical for clear communication, and it makes sure the next nurse who comes in knows exactly what's going on. It's such a simple step that prevents huge mistakes.
We are in the home stretch. Start the new infusion at the prescribed rate. Clean up your space, throw away the old materials properly, take off your gloves, and perform hand hygiene one more time. And before you walk out that door, always do a final safety scan of the room. Is the call light within reach? Is the bed in the lowest position? Are there personal items nearby? Your job isn't done until the patient is safe.
And that brings us to our final section, Part 3, Prevent. This part is all about critical thinking. You know, performing the skill is one thing, but knowing how to react when things go wrong, that's what makes you a truly great nurse. This is the what if part of our explainer.
You might want to screenshot this because this table is your best friend for troubleshooting common problems. Now, notice the difference. Phlebitis is inflammation of the vein, so you're going to see redness and feel warmth. Infiltration, on the other hand, is when fluid leaks into the tissue around the vein, so you'll see swelling and it'll feel cool to the touch. But look at the first nursing intervention for both. See that? It's always the same. If anything looks wrong, your immediate first action is to stop the infusion, period. And of course, nursing is never one size fits all. For our pediatric patients, the risk of fluid overload is massive, so you should always be using an infusion pump. For older adults, their skin and their veins can be incredibly fragile. You have to be gentle, assess their site very carefully, and maybe use paper tape instead of plastic to avoid skin tears. Learning how to adapt your technique like this is the mark of an expert nurse. So let's boil all of this down. If your brain is feeling full, just lock in on these key points. Aseptic or sterile technique is absolutely non-negotiable. You have to assess that IV site constantly, before, during, and after. You must prime all tubing to prevent air embolisms. Listen to your patient. They are often your best early warning system, and if you're ever in doubt, just stop what you're doing and get help. And finally, if you didn't document it, it didn't happen. So as we wrap this up, I want to leave you with a question to really think about. After everything we've gone over, what is the one step from this whole procedure that you will now never, ever forget? Thinking about that will really help cement it in your mind. And that's a wrap. A complete breakdown on how to change IV solutions and tubing safely and effectively. I really hope this explainer helped you feel more confident. If it did, do me a favor and give it a like, share it with your study groups, and of course, subscribe so you don't miss our next video. Oh, and by the way, we've put links to some fantastic, super summarized NCLEX revision books in the description below to help with your studies. Thanks for watching, and I'll see you in